So let's start with a procedure called FaceTite and NeckTite. I use them together because usually I do them together. What it is exactly what it sounds like. We tighten the skin of lower face and neck. The only previous option we had was surgical facelift and neck lift, and we'll talk about it later. But the non-invasive option is good for people who maybe don't have so much laxity in the skin. It's just starting to kind of get loose right over here. Maybe we're starting to see some jowls. We want to do something, but we're not ready for facelift. Also, for people who do want facelift, I add the FaceTite to that procedure to improve skin quality, because I don't want to keep stretching the skin that's already losing its elasticity. I want to add more elasticity to the skin and more collagen formation, and regular facelift and neck lift will not do that. So my facelifts, when I do it surgically, do also include FaceTite and NeckTite. With it. FaceTite, again, is a minimally invasive procedure. We use radio frequency technology, and it is a procedure that can be done in the office. Most of the time my patients are awake. Sometimes I will give them a little bit of medication to calm them down, especially people who are afraid of needles, because we do need to numb you up, like kind of like what dentist does, right? We inject numbing medicine. And once all the numbing is in, which is, I believe, the hardest part of the procedure for the patient, once everything is numb, when procedure actually starts, you really don't feel anything. I use 3 little tiny holes, which I create little entry points, usually kind of hidden behind your jawline, behind your ear, and then one underneath your chin. And going through those little holes, I go in, and first I will heat everything up with that radio frequency. On inside, it is like cooking bacon, meaning I always use that analogy. If you see bacon cooking in a skillet, everything kind of shrinks and oil melts off. Well, same thing happens on inside. The tissue starts to shrink and extra fat gets to melt. And then I go in with liposuction and suck out all the extra fat and extra melted fat. And that gives a really nice contour of the jawline. The jowls start to get tighter. And this process continues to happen for several months afterwards. I usually say final result in about a year. About 4 months we see best result, and it continues to get better and better and better. So this is not an immediate fix. It is something that you can be patient about. So if you come here and say, I have a wedding to go to in 2 weeks, I'll say, let's do something else like fillers. This is not a procedure where you're going to get quick results. There'll be a difference, but it's going to be also swelling and time until all the tissues get where they want to be with the elasticity and collagen formation and all that shrinkage that we're trying to create. NeckTite is basically same procedure, but I do the lower part of the neck. So when people start to get a little bit of that gobble going on over here, right? The skin sagging. Some people just have genetically extra tissue over here. This is the place where we can go and again suck out the extra fat and also shrink the skin, because last thing we want to do on a skin that's already losing elasticity is just take the fat out by itself and leave the skin hanging. So what I want to do, I want to take the fat out and shrink the skin as well. So FaceTite and NeckTite, it's the same technology by InMode and uses radio frequency heat to tighten the skin over time.